opiate crisis that we're in right now, overprescription of opiates. Now more and more research is coming out and showing that physical therapy can replace those strong narcotics, and we get similar results. Okay. Prevent further injury. A lot of what physical therapists, especially those that work in sports medicine and orthopedics, they are involved in preventing injury as well. Huh. I wonder why that happened. Let me just do something if you don't mind. Sorry about that. I'm just going to pull this down. Sorry about that. Well, I'll do it like that, and then at least you can read it, think a little bit better. At least that last one. So this last one, again, talks about empowering patients. You know, one of the things that differentiates a physical therapist from, say, a chiropractor is that chiropractors, they want you to come and see them 2 or 3 times a week, and you go in, they adjust your back, and you're in there for 5 or 10 minutes, and then you go. So you are relying on them to get better, as opposed to what the philosophy of physical therapy is, we're trying to empower you to get yourself better. So we do, at that last bullet, talked about patient education. Patients with low back pain, for example. With the patients that I have, I try to treat them in such a way that if this happens again, you know, down the road, this is how you can treat yourself, rather than having to run and come and see me. So I look at that as, again, empowering the patient to get better. So what do we do? This picture shows a therapist working with a pediatric client, and this one happens to be one that lost his or her, I guess it's his left upper extremity, and that's what this is supposed to be down in there, that prosthetic limb. So again, we work with kids with all kinds of diagnoses. Pediatric physical therapists, there's not a lot out there, there aren't many there, but we actually have one at Georgia Southern that teaches with us. She works clinically some days, but she's a full-time full-time faculty member in our program, and we are quite happy to have her. She started 3 years ago, just like I did. We have one physical therapist, he's an older gentleman, but if we ever had a Mount Rushmore of physical therapists who work in sports medicine, he would be on that mountain. His name is George Davies, and he has worked on at least 3, if not 4 different Olympics. He was here in Atlanta, well, up in Atlanta, working when the Olympics were there. I think that was '96. And he's been to 2 or 3 others as well. So some therapists are doing that. This is more me, so to speak, in that she doesn't look too old, but this is me working with a 65-year-old woman. But we work with a lot of neurologically involved patients that have had stroke, brain injuries, and things like that, okay, spinal cord injuries. So that's another place that we work. We work with women, not just pregnant women, but we work with women. We have a subspecialty called women's health, where we deal with a lot of women's issues, and we're quite successful in dealing with a lot of those issues, especially things like pelvic floor pain or dysfunction, especially when women become pregnant, they have pelvic floor problems. They also have low back pain for obvious reasons, so we work, there's plenty of therapists that just work with women in that regard. In fact, we have a student who's going to graduate in a couple of weeks who this is what she wants to do, is just strictly work with women. And you can see on these series of slides, we assist in different recovery processes. Here, we have a therapist working with individuals in a pool. This is aquatic therapy, and this is quite a large field. You can do a lot of things with somebody in the pool that you can't do with them on land because of the buoyancy of water helps alleviate, for example, if you have people with arthritis in their hips or knees or ankles, they can do a lot more in the pool than they can on land because of the buoyancy. This is an isokinetic machine that this individual is working out on, probably being tested by the therapist. I'm not exactly sure what this is, to tell you the truth. Almost of a wheelchair contraption or something, but I'm not exactly sure what that picture is. What else? So again, we're trying to make patients stronger, more flexible, and more stable. And here, this is certainly me working with my own ladies, okay? Working on trying to strengthen their lower extremities. Again, working on the lower extremities, trying to rehab probably a knee or an ankle problem. And we use various different therapeutic exercises. Again, not all exercise is meant to cause you to sweat and perspire, be out of breath and that type of thing. But these exercises are meant to make you stronger and more flexible. We use various types of modalities here. This is an ultrasound machine. Ultrasound similar to what you might have heard of women who are pregnant, that they go in for an ultrasound to get an image of the fetus. Here we're using a therapeutic ultrasound where it generates heat for tissue healing. Here's a therapist working on a woman's neck, trying to alleviate pain through mobilization. So many of our therapists who are involved in sports medicine or orthopedics can perform the same mobilizations that typically a chiropractor, you would think of a chiropractor as performing. Again, we do soft tissue massage as well, all types of manual therapy. Again, things like you would normally associate with a massage therapist. Many of the therapists who have manual skills are able to perform these very same types of things. And here someone is mobilizing the joints in the hand. In fact, we have, as I'll mention later, we have therapists that may only work with just the hand. So that's a rather arduous task. This is probably a woman that had a stroke of some sort, and here we're trying to get patients to regain use of an affected limb, or maybe they're an amputee and they've been fitted with a new lower extremity, for example. So again, we're trying to do different activities with them to make them more functional. We have some therapists that work only with patients with vestibular problems. Your vestibular, your inner ear, you can have problems with that, causes balance issues. And for example, over here, this one is working on a Swiss ball or a therapeutic ball. Maybe you've seen those as well. Working on balance issues. This is referred to as a BAPS board, where a person is working on trying to challenge her balance system. This patient may have actually had a stroke at some point, and because his balance is so poor that they actually put you in a harness so that you don't fall. You can do different types of activities in that harness. Sometimes the person is on a treadmill as well, it being in that harness. So all types of different things. The big thing here is we are trying to, and this is me for my older patients, relearn activities of daily living. So what are activities of daily living? Everything that you do from the time you wake up to the time you go to bed. All those activities that you do during the day are your activities of daily living. And we are trying to get these patients back to being able to do those things, such as it says walking, dressing, eating, bathing. We work with occupational therapists, especially in home care environment where I work. We work with the OTs in trying to come together to come up with a plan to address these activities of daily living as best that we can. So here's a woman that has had a stroke before, and it has affected her right upper extremity, such that she's in a soft brace, if you will. It's a hard plastic, but it has this Velcro straps over it, trying to keep her hand in a splinted way such that it doesn't contract, doesn't go into a fist. And again, I had mentioned before about trying to avoid injuries. And again, it doesn't have to be just that athlete that we're trying to help avoid injuries, but people of all ages. And here we're trying to improve their fitness, maybe to the point where so that they're less likely to fall. And I do research into falls prevention, in older people such as this, because when older people fall, they go into the hospital, and a third of them or so don't ever come back home. They end up dying or being placed into a nursing home. So think of it this way. Look at you three. If you guys are 65 years or older, I would do this. I would say, look at the person to your right, look at the person to your left. One of you is going to fall this year. So a lot of what we do, again, in therapy, is we try to prevent those falls. And again, more individualized conditioning programs. This is another type of machine, obviously. Okay. So where do we work? Well, a great number of us work in hospitals. People that I work with, that I teach with, a few of them work in the hospitals. I can think of 3 right offhand, who are working either every other weekend or whenever the need arises. A number of people work in their own clinic. In fact, where I came from in New York, I was a part owner in a physical therapy clinic, and so that was mine and my partner's clinic. A number of therapists work in rehab centers, and this includes all of the different rehabs. So physical therapy, occupational therapy, the nurses might be involved as well, and certainly physicians. Community health centers, those are facilities like the Golden Age centers that we might have here in Savannah, where older individuals would go and healthcare providers go to the clinic and do a weekly or a monthly blood pressure clinic, if you will. So therapists can be involved in that as well, going to those different centers. Obviously, nursing homes and home care agencies, and that's where I am. I'm in a home care agency. And sometimes we do go into nursing homes, but many nursing homes have their own therapy, whether it be OT or PT or speech. I used to work with a woman who worked in ergonomics. She worked in industry. She worked for Kodak, the photography company. And her job was to make sure that the workstations where the people worked were ergonomically correct. In other words, as safe as possible, that they didn't have to bend, might hurt their back, or they didn't do this to hurt themselves. So that was kind of a neat job. She still is working at that place. Sports facilities, these are fantasy jobs, so to speak. I don't mean to say that nobody gets them, but they're difficult to get because they don't open up very often. But we had a student who, as soon as he graduated, this was in the early teens, 2012, 13, 14, something like that, he actually was able to get a job with the Seattle Seahawks right out of school. And that gentleman, that faculty member that I mentioned before, that is on Mount Rushmore, he actually helped facilitate that student getting that job. And to my understanding, he is still working for the Seahawks. So those are nice, but they usually go to the more experienced people. Anyhow, research institutions and schools and pediatric centers. Public schools are obligated to provide therapy services to students. Maybe when you guys were in school, you saw a therapist come into your classroom and work with one of your classmates. That can happen. Pediatric centers, colleges and universities, that's where I am as well. So physical therapists, they are individuals today, and for the last 15 years or so. These are individuals who have gone to school and got their bachelor's degree. So you've already gone to school for 4 years. Then you go into physical therapy school, which is 3 calendar years. It's not 3 academic years. As you'll see, most schools are 9 semesters. So you start, for example, we start in the summer. So they go summer, fall, spring, summer, fall, spring, summer, fall, spring, and graduate in that 9th semester. After you're done with your formal education, some, not all, but a fair number of therapists go into what we call certified specialties. And you can see the ones that are listed here, all of these different specialties that these therapists generally work in, because you need to put in so many hours, you need to take an exam, become a certified specialist. And they typically, every 10 years, you need to retake that exam. So you gotta work X number of hours during those 10 years in that specialty. So this is the most popular, yes, thank you. The most popular one is the orthopedics, because a lot of therapists work in outpatient clinics, and the patients come to them with injured ankles and knees and all this other stuff. Neurology, I don't know if that's second most popular, but that's a popular one as well, obviously working with stroke patients, spinal cord patients, head injury patients, things like that. Cardiovascular and pulmonary, these are people that are working with people who have just maybe, for example, had maybe a stroke, but certainly a heart attack, and they're on the treadmill trying to get back into condition, and so the therapist is working with them in that respect. Cardiopulmonary therapists also work in the hospital. You get a lot of people with lung problems, difficulty breathing, and they're able to work with them to facilitate their breathing, for example. Pediatrics, we talked about. Acute care, those are the ones that are working in the hospitals, or sometimes people are discharged from the hospital, but they're still kind of weak. They're not ready to go home, but medically they're ready to get out of the hospital, which is charging them an arm and leg. So they go to a subacute rehab facility. So it might be another building, it might be designated floors in the hospital, but you go there and the therapies are working with you twice a day, every day, Monday through Friday, usually on the weekends as well. But that's where the acute care therapists might be working, okay? Hospitals or those subacute facilities. This is me working with my old people, geriatrics, so some of us are certified specialists just in working with all the different problems that older people have. The gentleman that I talked about a number of times now back at our place, he is a sports certified specialist. We have three or four orthopedic specialists on our faculty as well. Clinical electrophysiology, those are people that are using all of the things that you plug into the wall, for example. Clinical electrophysiology specialists, a lot of them work with wounds, and I'll show you a picture of that in just a few minutes, because we use electrotherapies to help heal wounds. I talked about women's health before, and I also talked about hand therapists. So all of these are clinical specialists that work in these respective fields. So here are some wounds on the lower extremities of an individual. Our therapists, and you don't need to be specialized in electrotherapy to work on wounds. But in home care, this is rather popular. There's usually one or two therapists within a home health agency that will treat just the wound. So they'll go in and they'll work on that person for an hour or so, because it takes time to pack the wounds and use the electrodes and stuff like that, and they use electricity to go in there, and it's quite successful in healing problematic wounds. I told you about this ergonomics before, where you go into the environment, to the work environment, the workplace, you do an assessment of the workplace environment and make recommendations on how to make it more safe for the patients. Kind of touched on this, amputees and prosthetics, usually in the VA system. This is where the therapists there are working obviously with amputees and getting the prostheses. And I'll tell you, these prostheses didn't look anything like it when I was in school. And nowadays, I challenge even the most skilled person to note if somebody is walking with an artificial lower extremity, because they're that good. You can barely notice a change in their gait. Kind of touched on aquatics. This is where we are working with people in, it doesn't necessarily have to be a pool, it could be something such as this. They have much larger ones too, other than this, but this actually has a treadmill on the bottom, so this woman is actually walking on a treadmill, talking to the therapist, probably telling the therapist how she's feeling, any pain and so forth and so on, just trying to get an idea of how she's feeling. So it's kind of neat, all these advances that have happened with aquatic therapy. a lot of kids work, so you could be a pediatric therapist working with kids in the pool. That's a popular one as well, and adults, older adults. So I'll take any questions if you have any about physical therapy and what we do, where we work, what we try to do at least.
What is the biggest difference between physical therapist and occupational?
My wife is an occupational therapist. She teaches, and occupational therapists do a lot of these very similar things, same things, especially with pediatrics. It's very difficult to distinguish between what OT is doing and what PT is doing, because they're both many times working together to achieve the same goal for that youngster. Occupational therapists, see, here's an example. If I, hurt my elbow at surgery, and I come out of surgery and I go see a physical therapist, we're going to work on strengthening types of things, all types of range of motion, strengthening things. The occupational therapist will take a look at that elbow, and he or she will try to incorporate activities of daily living, for example, the things that you do during the course of the day. So I'm having trouble getting dressed in the morning because I can't use that elbow, for example. So the therapist, the OT, will work with you on getting dressed using that upper extremity. I'm having difficulty, for example, working in the kitchen, cooking a meal, so they would work with you there. They would be possibly using adaptive equipment, different types of things. So rather than using, maybe you can't bend and button your buttons, for example. Now it's a hand injury. You can't button your buttons, so they give you a piece of device that makes it easier. You can do it with one hand. OTs are very good with adaptive equipment, especially for people who have had strokes, for example, when they can't use this upper extremity at all, but they still have to tie their shoes, or they still have to buckle their belt, things like that. So they're able to give you pieces of assistive equipment to help make things easier for you. There is a lot of overlap between OT and PT, but the OTs were the first ones to try to use functional activities to improve whatever you're going through, as opposed to straight exercise and range of motion types of things that PTs are doing for you. So, both very rewarding. You're working with many of the same. On a number of these slides, I could have said we're talking about OT, because they work with the same clients in the same environments many times. They don't necessarily have their own clinics per se, but they're in the hospitals and the rehab centers and working with pediatrics, working with the geriatrics, all that stuff. And I'll leave it. I don't want to let the cat out of the bag about Georgia Southern's OT program. So I won't say anything. I was told not to.
Oh.
So I didn't say anything.
I do have a question. I always have a question every workshop. But since we do have some future physical therapists in here, I was wondering, as college students, I know they have to do a lot of walking back and forth to class, getting in and out of cars, up, down, up, down. That eventually takes a toll on your knees. So I was going to ask if there were any kind of physical therapy exercises that you go through with some of your patients that maybe they could practice now, just with themselves, to make sure that they stay in tip-top shape.
Well, many, like I said, the patients that I see are older, the 65-year-olds, and a lot of them either have had knee surgery, for whatever reason, knee replacement surgery or hips, and they're just deconditioned in their lower extremities. So I simply ask them, and they have balance issues as well. So we try to strengthen, and we try to work on their balance. So I have them get into their favorite chair, whatever it might be, and I have them sit and stand out of the chair 10 times. And I try to have them use their upper extremities, if possible, as little as possible. And again, that's an activity of daily living. It's something that we do all day long. Get up and down, in and out of the car, as you had mentioned. For my patients, they're up and down, in and out of their chairs. And so I try to build it into their activities. rather than saying, okay, it's 10 o'clock, I gotta sit down and I gotta do my exercises, you know. I say to them, why don't you, rather than trying to do all these exercises at once or twice a day, build it into your day. So when you are putting the dishes away, clean dishes and putting them into the cupboards, you gotta reach up high, come up on your toes and just do that 5 or 10 times, and then put the glass or whatever it is that you're up there. When you are gonna get something underneath the sink, rather than just going down and put it under there, hold on to the sink and just kind of do as deep knee bend as you can. Do 5 of those. When you get out of the chair to go to the bathroom when you're watching TV, sit and stand 5 times, and then go to the bathroom. When you come back, sit and stand 5 times, and then sit down and watch your television show. So I'm trying to have them do these activities during the course of their day. You know, when you get out of bed in the morning, stand up, sit back down on the bed, stand up and do that 10 times, and then get up. When you walk down the hall, and it's a narrow hallway, and you can hold on, you know, rather than just walk down the hall, try walking with your one foot in front of the other. And then you can always hold on to the wall if you need to. But that's challenging their balance. When you're brushing your teeth, rather than standing there like this, brushing your teeth, challenge your balance a little bit, maybe put your feet together, or put one foot in front of the other. So these are things that they're doing. Why not do them with a little bit of a challenge? So that's what I try.
So for all your lazy friends out there, tell them they need to start doing some of these exercises.
That's right. Yes,
I have
sir.
a question. So, I know you was talking about undergraduate and graduate school.
Yep.
Once you do that 9 semesters of physical therapy school, to go on for your doctor, would that be?
So when you are done with those 9, sorry for interrupting, when you're done, you are a doctor of physical therapy. You are a DPT.
Okay.
Occupational therapy is going in that direction now, so if I were you, and you're thinking about OT, go to a program that is just a handful, but within 5 years, half of the programs, and within 10 years, all of the programs. So to keep you from having to go back to school after you go, find a program that is offering the OTD, the Doctor in Occupational Therapy. Because that's where you're going. Everybody wants to be a doctor, you know? PTs, OTs, some speech. You know, when you go to the doctor because your hearing's gone bad, you're going to a doctor of audiology. They've been there for a long time. So everybody wants to.
Didn't it just change, you can now get your doctorate degree in physical therapy?
That's what you're getting.
Yeah.
That's what all programs are now, is a doctor in physical therapy. Yeah. So after those 9 semesters, there are some schools out there that, and I don't know how they do it, but they're 8 semesters. Maybe they don't, maybe you start in the fall, rather than like us, we start in the summer. May 20th is our first day of classes for our class. So maybe they don't do that summer, maybe they start in August. So then it's 8 semesters. So I want to show you a little bit about our program. So I have to go in my mail. So give me a second. You guys have any other questions while I do this?
I have a question.
Sure.
So particularly when we get to therapy school, what percent would you say make it, and then what percent would you say no? And then with those 2 groups, why? Why would you say they make it, and why would you say they don't?
Good question. For us, that information, well, how many make it or don't, should be published on every physical therapy program's webpage. That's a requirement that we tell you. I think the number that we publish, and I would urge all of you who are considering this to go on our website. I think we're publishing 97% make it. So we have a class of 36. In the 3 years that I've been here in Savannah, we have lost generally 1 person each of those 36. Sometimes none, but sometimes one. We had one girl who had health problems, and she said, I just can't continue. We had some students that come in and say, after a semester or two, they say, man, this isn't what I was thinking it was. And then they leave. We've had, over the years, we've had a couple of students that that left because of academic difficulties. So each program will have what was I gonna say? I just forgot what I was gonna say. But all of this, every program, every school should have that information on their website. If they don't, they're probably hiding something. Now, one of the reasons that I came to what was Armstrong, now Georgia Southern, is because when I passed it on the licensure exam. So everybody that graduates, that's like one kid every 2 years that doesn't pass the licensure exam on their first try. But everybody has passed up, certainly by their second try. So, yeah, when I came from a program in New York that if we hit 80%, we were patting ourselves on the back. There were some years we were in the 70s and even the 60s. So that's not so great.
I know you was talking about, you said you had your own private
Yep.
clinic in New York.
Mhm.
So it's like starting your own private clinic, is that like more on the business side too, like kind of having like a business?
Yeah, and I didn't have much, but my partner, she had more business savvy than I did, so I leaned heavily on her. But yeah, it's good to have that. And, you know, you can work at a private clinic for a period of time, get to learn the ins and outs, and then you're able to do it. Now, that would be one way. I thought that I was going to have to go back to school to get like a business degree. I was thinking about going back to school for a 2-year degree in business.
That's still good information though, because I know a lot of students are looking at entrepreneurship within whatever field that they're going into. So never rule that out as like a possible means of income. It's like if you learn how to do the stuff, if you get certified on how to do it, then it shouldn't really make a difference on whether or not you decide to sell those services. As long as you know what you're doing, you know. I don't want to say that I know a physical therapist that graduated from my alma mater and then I sent somebody to twist their foot the wrong way.
Yeah.
How long have you guys wanted to go into this field?
Since high school.
Middle
Oh,
school?
good.
Since I tore my ACL.
Oh,
Yeah.
really?
Yeah.
That's a lot of kids, they write essays, part of their application, a lot of them, the majority have injured themselves, which has caused them to go into physical therapy to see a therapist. And they say, oh, this is kind of neat, and then lo and behold, here they are. Well, here's our class that's going to graduate. Right now, they are out on clinicals in all different parts of the U.S. But these are 36, sorry, this is 35. We could lose somebody. This is 35 of our best and brightest. So we're quite proud of them. And this is an Armstrong Center. This is the building where the physical therapy program is housed. CAPTE is how we say that, CAPTE accredited program. Commission on Accreditation of Physical Therapists Education. That's what CAPTE stands for. So all programs should be CAPTE accredited. You should, as you're looking at schools, make sure that they are all accredited by CAPD, or there are some schools that are just starting their program, so they would be a candidate, if you will. That's what they're candidates. So as I mentioned before, we're 9 semesters. We start this summer, and you graduate in May. Those are seniors right now, and really all of them. If you add up all the times that you are in clinical practice, it comes up to 32 weeks. So that's quite a few weeks. Our first year versus our second year. Our first year, we have this systems approach. Let me explain what I mean. Body systems. So in the fall, our first year students, for example, they're with me in the gross anatomy lab, and we're dissecting, for example, learning about the anatomy of the shoulder, for example. While they are doing that, or within days after learning the anatomy, then in their orthopedics class, they're learning about how to assess someone who has a shoulder problem. And they're also learning about all the different pathologies that are related to the shoulder. So that's what we mean by a system. We do that for all the major joints in the body. So we dissect it, we learn about the anatomy, and they get to apply that knowledge of their anatomy in the orthopedics class and in the pathology class of what's going on with that particular joint. We do that in the first year and the third semester, this semester right now, where it's more neuro. So I teach them about the nervous system, the brain and the spinal cord. And they're learning about all the different pathologies of the brain and the spinal cord and how to evaluate and treat somebody who has had some type of neurologic problem. So it's that type of systems approach. In the second year, it's more of a lifespan. So we start with the older adult. It would make sense to me if we started with the newborn, the pediatric, and work our way to the older individual, but we do it the opposite. In the semester, we start with the older patient, and we work our way down right towards the end of the semester of the second year, of the end of the school year, and then in the summer, between their second and third year, that summer, all 10 weeks is all pediatrics, and I'll show you a slide of that. So they start old and they end up with the newborn, if you will, in the pediatrics. 36 students, like I said, 98% first-time pass rate. So when I saw that, I said, boy, they're doing something right. As I kind of alluded to, but I never really came out and said it, we recently merged Armstrong with Georgia Southern, so we now are Georgia Southern Armstrong campus. This merger has not affected us at all. We were always on the Armstrong campus. That's where we're staying. So we still have the same number of faculty, the same number of students, so it really hasn't affected us at all. This says PTCAS, on the PTCAS admission cycle. So for all physical therapy, well, like 98% of physical therapy schools do it this way. PTCAS, this is the CAS system for physical therapy because there's other CAS systems for other programs. But the PTCAS is like a central clearinghouse. So you don't apply to Georgia Southern. You apply to PTCAS. You put everything that you need for an application goes to PTCAS. And then they handle it. They calculate your GPA, they calculate, or they receive all of your information, they calculate your overall GPA, your science GPA, they do all the work that we would normally do. Of course, you pay them. And they'll send your application to all the schools that you want to go to. Okay? So it's a central clearinghouse, if you will, for the application to physical therapy schools. Very few schools, even the one that I like in New York, which was always behind the times, even they use PTCAS. So like I said, a very great majority of schools do that. In terms of our program, that's Dr. Annie Beth Minzer. She's now the longest running faculty member that's been at Armstrong, Georgia Southern. So this was the example that I had given to you before in the first year. where we're using this integrated type of systems approach. So that's we try to have all of our systems. Boy, there she is again. Here she's helping one of our now third-year students with doing some mobilizations. So she teaches a number of classes, one of which, and that's what that picture came from, is our advanced orthopedics, where we teach students how to do more manual-based skills, mobilizations, manipulations, and what have you. Up on the top left, that's Dr. David Bringman with his Armstrong colored shirt. And he is simulating a patient, for example, that has a balance problem, so that person is in a harness. That's actually a student. And he's our neuro guy, if you will. He does the neuro rehab, treats patients with neurologically involved conditions. And Dr. Nancy Henderson, she is orthopedically trained. She's one of those clinical specialists. She's very involved with the military. She has a 1 day a week, sometimes more, but usually just 1 day a week job out at Fort Stewart, and she's developing a very nice relationship between Fort Stewart and our PT program. And the university is loving her for that. So here she's standing in front of a research poster that I'm sure she presented at a national conference, and we'll talk more about that as we go there. We emphasize, the clinic environment very, very early on. For example, both of these pictures here are showing a first-year student, such as Jordan, and I know her. This is an older picture. But we have our first-year student who is treating a patient that is actually a second-year student here and here, acting as a patient. This is a class that's being taught right now to our first-year students in the spring semester of their first year. It's called case management, and they treat this just as though it were a clinic. So we have real, and I'll use my finger quotes for real patients, but they are doing real documentation on those patients, and the faculty are assessing that documentation, and they are managing that patient. So this patient will come in over and over and over again during the course of the semester. And this is one of the most popular classes. It's very nerve-wracking for our first-year students initially, if they're actually treating somebody and get nervous doing that, and that's to be expected. But this summer, these first-year students are going to go out for on a clinical rotation. They're going to go out for 8 weeks this summer. And when they come back, they tell us all the time, this class prepared us so well for going out to the clinic that the other students from other schools that I was there with, they thought I was a third-year student. I'm a first-year student. They thought I was third because I interacted well with the patient. I knew what I was doing. I felt comfortable with the patient, mostly because of this class. So it's a great class. And we, meaning Georgia Southern, we are the only one to have such a class like this. So, anyhow, kind of neat. So here we are, our first rotation, as I said, right after the first year, at the end of the first year, they're out all summer long. Then they come back and they're second-year students, and they're going to go out. Intermittently during their second year, but their third year, it's all clinicals. They start the fall semester, they're with us for about a month, then they're gone. They're still gone. We're going to see them at the end of this month. The first week in April is actually when they come back. So when you're in your third year, you're not on campus at all. First month maybe, and the last month, but that's about it. So, stop me if you have any questions. Our curriculum is based on what the evidence shows. So what our students are learning is, when I went to school and we did many things, we would ask the instructor, well, why do you do that? And they'd say, I don't know, I just find that it works. There was nothing, no research behind it or anything like that. It was, I don't know, because it makes sense and it works on some patients. We don't deal with that anymore. Everything is evidence-based. It has to be shown in the research that this works because. And that's the way we try to teach all of our things. So we do have a capstone project that all third-year students, before you graduate, all third-year students finish. I say finish, because it starts now. Our first-year students, it is starting right now. They have picked a faculty person who will lead them in their research project, and it's group-based. Usually 3 or 4 students form a group, and they're going to do a group project. So I have a group of 4 right now, first-year students, and we are starting to work on our IRB, Institutional Research Board, or Institutional Review Board. They go by different names. It's a human subjects review. It's a board that you present your research, I'm gonna do this. They look at it and they say, okay, that's fine, so that none of the subjects get hurt or injured. So we're doing that right now. But my group of 4, we are gonna go out into the communities, into those golden age centers, those senior centers that seniors go to during the day. They socialize, they have their meals, they have different activities, and then they go home at the end of the day. We're going to go to those centers and we're going to do an assessment for their risk for falls. Then we're going to do a 12-week, a 3-month intervention where we exercise with the seniors. And then at the end of those 12 weeks, we'll do another assessment. So maybe their risk for falls was real high when they started, but after those 12 weeks, what we're hoping to show is that their risk for falls is now here. Okay, so we actually did something good for them. So that's the research that my group is going to do, and everybody has to do one. Okay, and you can see, for example, these 2 young ladies, who I was on their committee as not their director, but as a committee member on their research project, and they're standing in front of their poster that they presented at a national conference. This one was in New Orleans, where they were. So that was kind of exciting for them. The neat thing about our students, it says here, completing and defending the research project. Many of our students not only are successful in performing their research and coming up with a poster such as this, but they then submit their research to a national conference. And these national conference committees who judge whether they accept your research or not, they don't know that they're students. Everybody's names are wiped away. Nobody knows if you're a student, a faculty member, a clinician. So the majority of our students get their research projects accepted at these major conferences. And like I said, they're in competition with faculty and clinicians and everybody. So that just shows you the level at which our students are performing in terms of their research projects. We have a biodynamics lab, officially known as the Biodynamics and Human Performance Center. On campus, it's not in our PT building, but it's an adjacent building. And that's where a lot of research projects are performed using classmates and other Georgia Southern students. This is the class that I teach. We do cadaver dissections. We have 6 cadavers in our anatomy lab. And we start in the summer, so the first class that our new cohort will take is gross anatomy with me. We'll do it for about 4 weeks. And what we're doing there is we're preparing the students for the next class that they're going to take in the summer, which is cardiopulmonary physical therapy. So heart and lungs, if you will. So we are doing all heart and lung gross anatomy to prepare them for their cardiopulmonary course, and then they have another 4 or 5 week class in physical agents after that. But we have our own lab with our own cadavers. And the neat thing, since I started there, is that I have granted 24/7 access to the students to the lab. Before, it used to be, it was the end of the class, the professor would lock the door, and you gotta go. You really can't do much in 4 hours in the gross lab. So a lot of students like to study at their own pace, at their own time of the day, if you will, and with their own group or by themselves. So I give them the combination to the lockbox, and they get the key, and they open it, and they're in. I know which 36 kids are in there at all times. So if I walk in, there's paper towels spewed all over the place, I just say, okay, I'll take the lockbox away, and that's how I control the behaviors that go on in the lab. And I've never had a problem. Anyway, here's our pediatric summer. This gentleman right here, this was from last summer. This gentleman right there is the owner of a business that sells pediatric related equipment. So all this equipment that you see in these slides, he donated for the summer, for the use of, for the kids that last summer. And to thank him for his generosity, we actually got enough money in our budget where we're gonna buy all that stuff from him. So it was a nice two-way street. So that's our 8-week pediatric course between the second year and the third year, that's summer. I had mentioned before about our students presenting at national conferences. And I think I was wrong. Those girls presented here in San Antonio. That's right, not New Orleans. New Orleans was last year. But these are students who have performed their research. They produced this poster, and they get to, they applied, they were accepted, and here they are presenting it. So, and the nice thing about this is that the Graduate Student Association gives, you have to apply, but it gives awards up to $850 to students to be able to fly to these places. You know, none of them are really within walking or driving distance, right? So they gotta fly, there. And it's enough to fly there. They generally get one room at the hotel, and 18 kids go into that single room, and they're okay with that. But the trip's very little, if any, out-of-pocket expense. And the department also gives them a little bit of money too to help cover expenses as well. So, some students ask, well, what about, do you think I could work while, to help put money in my pocket while I'm in school? And we generally tell our first-year students, no, that's not a good idea, because Monday through Thursday, you're in class roughly from 8 to 5 every day. We have Fridays off, and that's the day that most of the faculty that do work in the clinic, they go out and they work in the clinic on Friday. Our students are playing catch-up, maybe they're sleeping in a little bit for the first time in the week, but they're playing catch-up and doing other types of things. Sometimes you need a little break, you know what I mean? So you get out in the nice weather, go for a walk around town. I need a break. So Fridays are generally off. There are occasions where an exam will be on Friday. So rather than me taking up valuable class time in my Monday, Wednesday gross class, I'll just schedule the exam for Friday. And that way we don't lose any time. So that happens, not often, but occasionally. The second year is a little bit different in that our second year students have Fridays off, like our first, but they also have generally Tuesdays off. That doesn't mean that they all work, but one of the nice things about being a second year student is the graduate assistantships that are available. These are competitive positions for graduate students. They apply, and if accepted, they get free tuition and a stipend of close to $8,000 for the year, which is not a bad amount of money. It's during the academic year, and our program, PT program, has a graduate assistant, but they have multiple graduate assistants on the Armstrong campus. So if a student, we had, say, I think 12 kids, 12 of our PT students, 12 of our first year students applied for the GA position for the second year. We chose one. So you're thinking, those other 11 didn't get nothing? They didn't get anything? They probably will. They'll get a GA in the education department or a GA in the fitness center or a GA position over there. Because we have such a good name. I'm not trying to say anything that's not true. Our students have such a good name on campus that other organizations love to have the PT students work for them as a GA. So like I said, I almost guarantee those kids that weren't accepted by us will get a GA position. Here's the other thing. I don't know how long this will last, but remember how I showed you Nancy Henderson, Dr. Henderson, working very closely with the Army, with Fort Stewart? That relationship brought 10 GA positions for our students. So 10 other PT students were able to gather a GA position out at Fort Stewart because of Dr. Henderson. So, a nice relationship, like I said. Third year, you really can't work because you're in the clinic. But you might say, well, I can get a job, working evenings, busting tables at this or that. Many evenings, our third year students are actually doing, well, they might be finishing up their research, that capstone project. But certainly when they have a patient that they're seeing in the clinic and they're having a difficult time, they don't understand one thing or another, they ask their supervisor, the clinical instructor, who's a PT, they say, they talk about it, the clinical instructor say, well, this is what I want you to do. Tonight when you go home, I want you to research that particular problem on that particular patient. And then in the morning, we'll come back and we can talk about it. So that's how many of your evenings will be spent in your third year. You might be able to sit down and watch TV once in a while. But now that, what's the show? Now that The Bachelor's over, right, is The Bachelor over? Who wants to watch TV? Here's an inside joke with another student. This presentation that I'm giving you with these slides, we give this presentation to prospective applicants. So we have these information sessions that we hold monthly generally, and we get people from all over the state that come in for this type of thing, and they tour the campus and what have you. So we have this slide up there where we talk about location, location, location. I don't have to tell you guys about location, 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 because you live in it. But where else would you rather be than right here, right now, huh? In Savannah. So here this is what you needed for us. What I'm about to show you is generally the case for most PT programs. Okay, they're all about the same. So these are the prerequisite courses. And I'm sure most of you have many of these, if not all of them. You can see this one right there, 5 of the 8 science courses of these courses, 5 of the 8 courses must be completed when you submit your application. We'll talk about that. So you could be right now taking a couple of these courses, up to 3 of them. You could be taking in the semester before you start. And that happens as well. How's it going? So here's our requirements. The graduate record exam, the GRE, that's kind of like the SAT, if you will. And here's the numbers, okay? And those are the numbers that we want, and these are the numbers that we're getting. So you can see slightly above what we're asking for. Here's our GPA, our minimums that we're asking for, 3.0. That's generally about the case for most of them. And this is what we're getting. Now I need to make a slight modification to this. Elizabeth Varner, whose name is on the very last slide, she's our contact person. She told me that this number for this last group was 3.7 overall, but the science GPA was 3.4. So that went up and that went down just a bit. Now, you can see here's that PT CAS again. They are the ones who calculate your science GPA. And unfortunately, on that last slide that I showed you, the science is 2 chemistry, 2 biology, 2 this, all of those science classes. They do those classes, and to me that makes sense. To me, that's all that they should do. Those science classes that are prerequisites. Unfortunately, let's say you're a biology major or a chemistry major. If you're a chemistry major, you're not only taking general chemistry, you're taking organic, maybe P-Chem, you're taking this chem and that chem, right? So I had 2 A's in those other, in the general chemistry, what I need, but I didn't do as well in the other couple of chemistries. Guess what? PT-CAS is taking all those chemistries and calculating your science GPA. You're a biology major. I got 2 A's in those general biology classes, that's not a problem. But this bio, I got a C, this one I got a B minus, and blah, 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 blah. Well, guess what? Unfortunately, PT-CAS takes all of those and gives you a science. And so it's almost a disincentive to try to take more difficult classes as an undergraduate, because you're gonna get dinged by PT-CAS if you get a low grade. So I have a problem with that, but that's another story. All right, what else? Remember, you had asked me before, why do some kids not make it? And I said, well, we had a girl a couple recently who said, this isn't for me. I thought it was, but it's not for me. We don't like that, because who wants to go through 4 years of school, think you know what you want to do, get in the program that you want to do, and then start to realize, oh, this isn't what I thought it was. So here, we're looking at you to perform at least 75 hours of being in the hospital, if you will, working or observing what the therapist is doing. And this is actually competitive, to tell you the truth, because there's so many kids out there that want to go into PT, and all programs now are asking applicants to do some observation hours. So you might contact this clinic or that clinic, and they might say, I'm sorry, we got enough kids that are watching. So start this early in the process if you can. So 70 hours, and you can see that we don't want you to just do all 75 hours at the clinic down the street. We want to see that you're out in a number, more than one setting. So you're in the hospital for 10, you're in the clinic over here for 10, maybe you ride with a home care agency therapist for 10 hours, that type of thing. But minimum of 75 hours and more than one setting. This is a new test, CASPER. We will be the first US PT program to require the CASPER test. There's many Canadian schools, there's a lot of US medical and PA school physician assistants. The CASPER test is a situational judgment test. In other words, it's nothing that you can study for, but it's a test where you'll be asked, we have two people on the heart transplant list, and one heart became available. And this person, he's old, he's got emphysema, they're checking him for cancer right now, but he's number 1 on the list. And then we have another person that's much younger, blah, 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 blah. Who are you going to give the heart to? And there's no right answer, but we want you to tell us who you think should get the heart and why. See what I mean? It's those types of it's a situational judgment test. Okay? There's no right or wrong answer. We just want to figure out what you chose and why you chose it. And I think there's 12 of those, 12 scenarios. It takes about 90 minutes. And it's online. You take it on a computer. The only thing that they ask is that the computer that you take it on has to have a camera, because there's someone on the other end of that camera who's watching you. Because when you say you're Bob Smith, they want to make sure that Bob Smith is the one taking the exam, not Bob Smith's father, who has more worldly experience. Yes?
How do they grade
Yeah, they have people who do the grading, and you are assigned a score. It's not, you got a 90 and you got a 95. It's not that. But they do come up with a number score, and they report that to us. Okay? So we're not judging your cognitive abilities with this. We're testing things like your ethics, and, nothing having to do with your intelligence, but what type of person you are. How much empathy do you have? Things like that. professionalism. Okay.
I have a
The
question.
number one complaint from faculty in all of colleges, in their professional programs, it has nothing to do with how smart the students are, but it's how professional acting they are. Okay? So this is one of the tests to try to maybe weed out some of that. Go ahead.
Oh, this is a part of the centralized application system?
No, this is different than that PT CAS. Yeah, this is a different company. This goes up into Ontario. This is, the school is called McMaster, up in Ontario, Canada, and they handle all of that. Yep. So we'll get a PT, well, you don't get a score from PT CAS, but we get your application from them. But this is completely different. A separate, this costs $10, so it's not, we don't think it's terribly expensive. We also asked that you had 3 letters of recommendation, at least one from a PT that was with you during your observations. And let me just warn you of this, because I used to read these applications, or these letters of recommendation. And so here, if I had one student, I had dozens and dozens. They go and they ask, some person who they think is gonna give a real nice letter of recommendation, maybe that therapist that they were working with in the clinic for umpteen hours. Yeah, he'll give me a good one, or she'll give me a good one, so you ask. This is their letter of recommendation. Bob Smith was at our clinic, and he observed me for 50 hours, period. That's their letter of recommendation. Be careful who you ask. Be careful who you ask. Because we see something like that, they might as well said Bob Smith shouldn't be a therapist, or Bob Smith is the worst. That's no letter of recommendation. Be careful who you ask. If that person thought he was getting a great letter of recommendation, that's what he got. But you send these into PT CAS, this is another thing that PT CAS will then send to us. There you go. Years ago, well, 2 years ago, it ended 2 years ago, we used to ask for a supplemental fee of $35. And a number of schools may ask you for that. Many schools here, I think all of them, all the other schools in Georgia ask for an additional amount of money. Because they're not getting any money from PT CAS. You're paying PT CAS, you're paying them to send out your application to all these different schools. Some schools will want an additional amount of money. We ended that a year or 2 ago. So you don't have any out-of-pocket expense for us, I guess is what I'm saying. Again, I would urge you to take a look at our website, and take a look at every school's website that you're thinking of applying to. Okay. We have 2 different ways, 2 different types of admissions. One is early admission or early decision, and that application, the PT CAS site will open on the 5th of July. It will close on August 15th. Now, early decision is different than others. Early decision is this. You guys as students have investigated Georgia Southern, you visited the campus, you like what you saw, you like the faculty, this is where I want to go. I don't want to go anywhere else. So you apply for that early decision. If you get accepted, you're in. You got a seat. You're one of our 36. You can't go anywhere else. Later on, you might say, man, I want to go to Georgia State. I happened to walk by and I saw Georgia State. I really liked it. Can't. Because if you leave us, no one else is going to take you. Okay? Those are the rules. So we accept students early decisions like that. We also accept students, as it says, regular decision. And that deadline is October 1st. Okay? So you have a little bit longer, but But now, if you don't get into our program, you have other choices. You know, the regular decision kids are applying not only to us, but they're applying to all the other schools in the state, everywhere that they want to go. There's none of that bindingness, if you will. Okay? So regular decision, you're free to accept. I mean, we had students that we accepted way back, it doesn't say, but way back in late December, early January is when we let the regular decisions kids know. We had kids all the way up till last week who we accepted would write it, they paid a deposit, $500. If you're early decision, you don't have to pay 500 because you can't leave. But if you're a regular decision, you pay us $500 to save your seat. We had kids until last week that were still dropping out, keep my 500, I'm going to Georgia State, or I'm going to XYZ school. Because I live in Atlanta, I really wanted to go there, it's much closer to home, I'm gonna go there. So a spot opens up, we keep that $500, and now we have a waiting list of students. So if you don't, and this is going on with all the schools, not just us. So if you don't get in during either early or regular decision, but you're on a waiting list, you still have a, I don't know if it's a good chance, but you still have a chance to get into that program, okay? So up till last week, here we are in March. 3 months ago, we accepted these kids. And some of them are still dropping out. Okay? So you see all of those numbers, you see all those, you know, we want a 3.0, we want GREs of 140, 146 and 144, and we want all these minimums. Those minimums are there because we think that if you have those minimums, you're going to be successful in our program. So just because you don't have 3.5 or 3.6 doesn't mean you won't be successful in any program, is what I'm saying. That's what those minimums mean. They mean if you reach them, and you get into that program, don't feel, oh man, him and her, they got 3.5, 3.6, I'm just a 3.3. No. You know what a 3.3 is versus a 3.5 or 3.6? You got 3 or 4 B's, and that person got 3 or 4 A's. Not much at all. So don't worry about that. What else do I got? We bring you in. We interview for the early admissions. We interview 60, and for the regular admission, we interview 60. It's a half day. You'll come in and you'll talk one-on-one. You'll be in a group of 3 or 4 or 5 people, where we look at group dynamics. How well do you interact with your other people? Are you standoffish? Do you sit in the corner and not add anything to the conversation? You know, that type of thing. So we're looking for group dynamics. Like I said, the one-to-one. And then you're going to write a short essay for us as well. Yeah, these are, when we let people know, I already said that before, early decisions, you're notified by late September, and regular decision, it says mid-January, that's a little late, I think it's late December, early January, when we tell people. So what else can you do while you're there? Is it all schoolwork? Well, no. We have different activities for the kids down there at the volleyball group. We're having a 5K or 10K race at the end of the month. So if you're sticking around and you'd like to run, come on over. And you can sign up. And that has different themes you can see up there. This is when we were still Armstrong, and it was some type of pirate type of thing. I forget what the theme was at that time. We had one faculty member, Dr. Davies, brings the students out to Tybee in the spring semester in the afternoon on one particular day, where they do a gait analysis lab, because it's easy to see somebody's footprint in the sand. So that's usually a fun time that kids take advantage of that. And some of them stick around for the rest of the day, because they're usually done by about 3 o'clock or 4. As I had mentioned before, we try to bring real patients into the clinic as well. This is Dr. Brewman again. You can see he's bald. It looks like he's got gray hair, but he's actually bald. So is this gentleman, as they shave their heads for some type of contribution for cancer research or what have you. In fact, he told me today that he's getting ready to go through it again. So I think later this week, as a matter of fact. So that's Dr. Brewman. Our students pride themselves on doing well in the intramurals. You can see that they are champs in various aspects. So we have a PT club, and they're constantly updating the rest of the students how well they're doing in whatever particular sport. So they do volleyball, they do football, I think it's flag football, volleyball, basketball, a number of other things as well. So if you're inclined for that. Here's that SAPO program. I kind of alluded to it. This is Dr. Henderson again. This is the captain. He was the physical therapist. He's no longer there, but he left about 6 months ago. But here's our students that are working with the soldiers and doing injury prevention types of things. And this is just exploding into a huge relationship between Georgia Southern and the military. SAPO is an acronym for something, but it's essentially a tactical athlete. So when you are a fireman, a policeman, a first responder, or in the military, and you do these types of activities, you are considered a tactical athlete. That's the new term. Dr. Henderson also has an undergraduate degree in Spanish, which is kind of unusual, but because of her knowledge of the Spanish language, she actually takes a group of students, not just PT students, but a group of students to Costa Rica every year. They didn't go last year because there wasn't enough student interest, but as long as the student interest is there, they go and they experience healthcare down in Costa Rica. I think that's it. Yep. And there's our admissions person. She's online as well. You can get her name and number, email her if you have any questions. I also have my business card here. If you're more than welcome to contact me. I have it somewhere. I'll find it if you need it.
I think we're right at the top of the box.
On the top box?
Mhm.
Yeah. But you're more than welcome to contact me or anybody. Okay. If you have any specific questions, if you want to come over, and I can show you around, I can introduce you to some people, whatever you might like to do. So I'll answer any questions that you have that are specific to our program or physical therapy in general as well.
While you guys think of questions, just to let you know, presentation number 3 is going to be on Tuesday, the 26th. That is the Tuesday after spring break. It's going to be a lot of the same information, but if you think of some more questions or you want to bring some more students, feel free to come again on the 26th. That's going to be the same time, 3:30 to 5:30. The Success Center is also going to be doing more events, and we'll be putting out an announcement this evening about our summer employment, summer jobs that are available through our program. I'm sorry. So just make sure that you keep checking emails. Do you guys get my emails? Yes. Okay. Good. Well, thank you guys for coming. If you
Thank you for
have more questions, feel free to ask them now. If you have a question for me about STEM Success Center, I'll be glad to answer them. I also did not bring my spinning wheel, but I did bring some laptop bags for the first 3 people. So, first person I remember, I do remember that she was the first one here. I don't remember who came second though. Did the guy? He left? All right, well, since he left, you're the next person. And that's what you say to him. And you were the third one. There you go. All right, so just make sure you let people know that you can always win something by coming to a STEM Success Center event. Thank you, Dr. Carnes. And
Thanks again for coming, guys. And grab some stuff if you
yeah,
want.
please.
Okay, whatever you want, cups and what have you.
And make sure if you did not sign in, that you sign in before you leave. Make sure you put your 915 next to your signature. Much appreciated.
No, well, one of the slides that we had up there before you came, and please go to our website, it'll show you the classes that you could be a history major. I showed you that one woman, she was a Spanish major, but she had all the chemistries, biology, and all the other classes that you needed in order to apply.
Break it down, I'm about to break that down, and you can take that stuff that I have over there, put it on the cart, start putting some of this other stuff in the front on the cart too. That way we can push it out. Did you want to leave your boxes here again?
If I could.
Yeah.
Kind of saved me